So what about people with like tennis elbow, things like that, or carpal tunnel, or arthritis in their hands? How well does it work for that?
I mean, that's
stem cell therapy.
Yeah, I mean, this is also a very common thing we treat. Sometimes we use stem cells for this. Sometimes we'll use platelets. It depends on the condition and what the problem is. In the elbow, we see a lot of tendon problems. Tennis elbow on the outside, golfer's elbow on the inside. Very, very common thing to treat. Usually platelets concentrated.
What does that mean, by the way?
So platelets come from the blood. Normally we think of platelets as rushing to a site of an injury to stop bleeding. And that's the first thing they do. But then they open up and they spill out their internal components, which are things called growth factors. And there's a lot of these growth factors in there. They're basically, I tell people, they're like phone calls to subcontractors. Each growth factor is making a call to the plumber or the carpenter, bringing them basically the resources over to repair tissue. So platelets contain within them the resources that are necessary to orchestrate the rest of healing. And they actually make a phone call to stem cells to come to the area. So we don't always have to use stem cells. We can use the platelet growth factors to make that call so the body uses its local stem cells in the area. So we can use platelet growth factors, we can use stem cells to repair tissue. If they have a tendon problem, it just depends on how severe it is. More mild to moderate problems can use platelet concentrated products, and the more severe problems need stem cells. We see a lot of problems in the hand and the wrist. A big one is thumb arthritis. I have this guy, he's a professional drummer. He's worked with a lot of the most famous drummers, most famous musicians like Van Morrison and other people. Oh. And he's in his 70s, he's still drumming, but he's got really, really severe thumb arthritis. We did a stem cell procedure on him. He's doing great. He's still drumming. And that's kind of what we want to do. We want to get people back to doing what they love.
So with this particular guy, for people just tuning in, so you go in with a small injection, go into his bone marrow, take the stem cells, like your lab turns it into the...
Yeah, so they isolate. We have a highly trained laboratory technician working in a 1,000-pound sterile hood, getting a product that I'm requesting, individualized for that particular person's problem, tissue, their age, all these different things. We can make different types of products, not just spinning the stuff down and getting a product. So once I have that liquid, then we use...
Like in his hand, you just injected it?
Yeah, so we have sophisticated techniques. We're going to use ultrasound, we're going to use live x-ray to get into the joint, into the surrounding ligaments. I may inject around the nerves in the area, try and get the whole structure to be healthier and better. Usually there's multiple things going on.
So the drummer with the bad arthritis, so what, a couple months later he's back?
Yeah, I mean, it took about 2 to 3 months, and then he feels as good as he needs to feel to be able to tolerate all of that drumming that he does.